All right, team. We have a challenging case on our hands. The patient presents with lymphadenopathy, calcific tendinitis, and mastoiditis. What are your thoughts on the diagnosis?
I think it could be sarcoidosis based on the symptoms.
I'm leaning towards Erdheim. Chester disease, given the presentation.
I believe it might be fibrodysplasia ossificans progressive looking at these symptoms.
My diagnosis is chronic recurrent multifocal osteomyelitis, considering the clinical picture.
No, no, and no. It's malignant infantile osteopetrosis. Don't you guys see it? Gary and Randall, prepare for pneumonectomy. Prepare for pneumonectomy. It's a risky procedure, but I have a feeling it's the right call.
Are you sure about this, Dr. Hawks? It's a dangerous surgery.
We should reconsider our options before going ahead with such a drastic measure.
I've made my decision. Gary Randall, get prepared. Leslie, Frank, I need you to break into the patient's residence. Look for any clues that might shed light on this case. Time is of the essence here. Let's move.
Oh, Christ, another breaking and entering. At some point, you'll have to answer for us if we get arrested.
Leslie, that is a sacrifice I'm willing to make. Tracy, you called me into your office.
What's the problem? Hawks, I heard you want to perform a pneumonectomy on your patient with malignant infantile osteopetrosis. Are you sure about this?
Of course, I'm sure, Tracy. I have years of experience, and I know what I'm doing.
Hawks, you have a track record of being wrong in these critical situations. I cannot just let you proceed without any doubts.
Oh, piss off with that crap. I'm the one keeping our goddamn patients alive, and you're just stonewalling me.
I don't know about this.
You don't know about anything. It's a miracle you keep getting leadership roles.
Oh no, the patient is in critical condition. We need to figure out what went wrong with the treatment.
I have a feeling pneumonectomy wasn't the right choice for malignant infantile osteopetrosis, despite what Dr. Hawks insisted.
You might be right. We need to act fast. What do you think could be the correct treatment?
Let's not panic. We will find a solution. Maybe Leslie and Frank uncovered something at the patient's home that can guide us to the right diagnosis.
The patient is an infant, for Christ's sake. Are they going to find out the kid's on irregular medication or something?
Could be the dad selling his infant's medication to make ends meet. The name sounds familiar. I think I've met him at swap meets before.
You're a disturbed individual.
Frank, I'm not finding anything.
Gary suspected we wouldn't find anything. He says the dad's name sounds familiar for some reason.
Oh, God, is this another case where he believes he's done deals with someone?
Probably. Anyway, I'm out of ideas.
And what about this treatment plan? Dr. Hawks insisted on a pneumonectomy, but it doesn't seem to add up.
Exactly.
The clues in this home don't align with what Hawks is seeing. We need to reevaluate our approach to treating malignant infantile osteopetrosis.
How could you all have misdiagnosed this patient with malignant infantile osteopetrosis? And, pneumonectomy? Are you trying to kill them?
What we discovered at the patient's home.
It wasn't relevant to malignant infantile osteopetrosis. We had to act quickly based on the information we had.
Hawks, what do you think the correct diagnosis is then?
Yeah, we need to know how to proceed from here.
You're all incompetent fools. I'll figure this out myself. Don't bother trying to keep up. You're all a disgrace to this hospital.
You told us to break into a house and you're surprised we didn't find anything there to help with the case.
You're supposed to be helping me have a reason to keep you and Frank here at all. You know, Johnson, I've been thinking about that puzzling case I have on hand. Something just doesn't add up.
Oh, what's been bothering you about it?
I can't shake the feeling that I'm missing something crucial. It's like a piece of the puzzle is right in front of me, but I just can't see it.
Well, have you tried approaching it from a different angle? Sometimes a fresh perspective can do wonders.
You might be onto something there. Thanks for the suggestion.
No problem. So how are things going in the oncology department with your patients?
They're stable for the most part. We're making progress slowly but surely. Wait a minute. I think I've got it. Johnson, I know what's wrong with my patient. I have to go check on them right away.
Oh, okay. Well, good luck with that. See you later, Hawks.
Rushing off, thanks. Johnson, catch you later. Sorry I'm late, guys. Had to rush over from lunch with Johnson.
What the hell, Hawks? You can't barge in here without protective gear?
This is an operating room, Hawks. You know better than that.
Yeah, you're putting everyone at risk with your reckless behavior.
Listen, malignant infantile osteopetrosis diagnosis was off.
It's epidermolysis bullosa.
Epidermolysis bullosa? What's the prognosis, Hawks?
Epidermolysis bullosa has a grim prognosis, unfortunately.
How did you come to this conclusion during lunch with Johnson?
I noticed the signs, ran some tests mentally. It's clear as day now.
Oh, knowing you did something mentally is really reassuring.
Tracy, I came to apologize. I was wrong about the diagnosis.
Oh, I see. Well, congratulations on finding the correct one for the patient.
Yeah, it was a team effort. If only I had more competent colleagues.
Wait, what do you mean by that? You were the one who made the initial mistake.
Well, my team should have caught it sooner. It's not all on me. Gotta go.